Thank you for watching. I'm Dr. David Mashhadian. I'm a cosmetic surgeon in Rodeo, Beverly Hills. Today we have the pleasure of taking care of my patient. We are doing hand rejuvenation. And what we're using is the Radiesse. The Radiesse does not come with any numbing cream in this particular syringe, so we mix it with the lidocaine previously with this little gadget that helps us to put some numbing medication into the syringe. We've already placed some numbing cream on the hand and already prepped the hand. And with the aging hand, what happens, obviously the skin quality changes, you get some pigmentation, the skin thins out, you lose some fat, and you start developing and showing some veins and tendons. So that's what our patient is complaining about, and that's what we're going to be treating. Just to educate you for a little bit further, the Radiesse syringes come in two different sizes. This is the 1.5 ml, and you really need at the minimum the 1.5 ml to treat each hand. And then if the patient desires so, they could come back for additional treatment at a later time. Bruising is an issue, so afterward we usually provide our patients with a oral arnica forte, which is a combination of arnica and bromelain that helps with bruising and swelling. And her skin is already prepped, and we all usually have the patient wash their hand and prep the skin, and we're going to go ahead and show you how we do that. For before and after photos, I recommend that you visit our website or call our friendly office, and we can show you some before and after photos. But on the videos, it's kind of hard to show before and after photos, obviously. Okay. So we use what's called a tenting technique. There are a lot of little vessels. We want to make sure you don't hit those. So you get a little bubble here, and what you do, you just press on it and massage the material into where you want it to go. And you can see already it's gotten some improvement. So we go between each tendon and slowly fill in the areas, and then at the end I will do additional massaging. I also have a little bit of acid tracing ointment that will help me massage the patient's hand and get the filler into the appropriate area. So Dresden is also complaining about a little bit of side hollowing, so we're also gonna treat this area a little bit for her. Now for the back of the hand, we're also going to work placing about 5 bubbles on each area. Here's the back portion. Place approximately 0.2 ml for each bubble, and then I'll massage it and work it into each area that I need to. I think you're starting to bruise a little bit now. Our patient today, she is on a little bit of a anticoagulation, so she's a little bit more, has a more propensity developing a little bit of a bleeding, so I'm being a little bit more cautious, but no matter what you do, you're gonna have a little bit of bruising. So for those of you who watch, if you notice some black and blue, she's just a little bit more, she's on blood thinners, so she's more likely to get some What we do here now is I'm going to show you the transfer of the remaining material back into the syringe. So we can continue doing our work. We have completed Radiesse injection for hand rejuvenation on the right hand of our patient. Our patient is on blood thinners, so this procedure can safely be done with some mild anticoagulation on some of the concerned patient. Obviously, there is more chance of bruising and a little bit of more swelling. Our patient is fully aware of that, but you could see the immediate improvement. Unfortunately, there's a little bit of bruising here in this case. So we're gonna go ahead and now continue with the left hand.